Hello there. This is the 7th of a series of lectures on bone healing and pathology, and you finally get to realize why I themed this after Mr. Glass. It's because he has one of these diseases. Right? He's known for his fractures. He has Osteogenesis Imperfecta, and we'll talk a little bit about that, as well as Osteopetrosis and Achondroplasia, so genetic bone diseases for this lecture. So the Mr. Glass disease, Osteogenesis Imperfecta, also known as Brittle Bone Disease, because these patients are known to be really susceptible to fracture. If you haven't seen that movie, one of my favorite comic book movie characters, Samuel Jackson, does a great job. But what is brittle bone disease? It's a defective formation of type I collagen that affects the form of bone, leads to extreme skeletal fragility. These patients tend to have dozens, if not hundreds, of fractures throughout their lifetime. One of the classic features is they're known to have a blue sclera, at least in type 1. We'll talk about what that is coming up. Thin skin, skeletal deformities, and osteopenic appearance. And so this is a quote from the movie. This is actually from Unbreakable, which is the first of a series of movies with Mr. Glass in it. Let's see how accurate he is. He says he has osteogenesis imperfecta, genetic disorder, yes. He doesn't make a particular protein very well. Yeah, that's true. It's that type 1 collagen. And his bones are very easy to break. And he says he has the tamest version of the disorder. There's type 2, type 3, type 4. Type 4s don't last very long. Actuality, there are 8 types, and type 2 is the most severe. That's the autosomal recessive one, which they do usually die within the first year. So didn't quite get it right here, but we don't want to go through and name all 8 of them anyway. For our purposes, you just need to really be familiar with what type 1 is. That's one that's associated with Dentinogenesis Imperfecta or opalescent dentin as well. And that's found in about a third of cases of Osteogenesis Imperfecta. And if you don't remember what Dentinogenesis Imperfecta is, that's one where they have narrow roots, especially at the cervices. So it makes it look like they have very bulbous crowns, reduced pulp chambers. You can really not even see the pulp chambers in these teeth. And then clinically, these teeth are going to look amber-like, translucent, or maybe a bluish gray. You can kind of see the opalescent appearance. The enamel can fracture easily and wear away. All right, osteopetrosis, osteo meaning bone, petrosis meaning stone, so stone bone basically, or marble bone disease. These patients also have brittle bone. You would think they might be stronger, right? They're just completely filled in with calcification. They don't have a lot of marrow space, but that does a couple of things. It makes them more brittle, and so they are more likely to fracture. I don't think nearly as likely as osteogenesis imperfecta, but they do fracture more easily. And what is the effect of not having that marrow space? Well, what's made in bone marrow? That's where a lot of the blood cells are made, and so they'll be susceptible to anemia and infections. In some cases, it can narrow the cranial nerve foramina, which leads to blindness and deafness and facial paralysis. The severe type, as in a lot of diseases, the severe autosomal recessive disease can be fatal for infants. And so what are the effects this has on the jaws? Well, the teeth may be delayed in erupting because that bone is so dense. Some of the teeth may be missing or malformed, hypocalcified, more prone to caries. And the canals in these patients are going to appear a lot more prominent because of the degree of calcification around the canals in the bone. What do we see going on here? A case of osteopetrosis where all the bone just looks more dense. Not a very extreme case. Maybe if you saw the skull, it would be more apparent. But it's not just a single localized area. Not uncommon to see just sclerotic bone around an infection like this, but we see it on both sides. We see it in areas where there isn't really sign of infection, but we do also see signs of infection. What's this arrow pointing at? That's a periosteo reaction, which is one of the classic signs of osteomyelitis. And so we said these patients are more prone to infection. So this is kind of a double whammy here. We have a patient with osteopetrosis and osteomyelitis. It looks like they had an extraction here, not healing well. And that's one of the things that goes along with this disease. Because they don't have normal marrow to produce normal blood cells, they are more prone to infection and non-healing, as we see here. All right, last one for this video is achondroplasia, which there are many forms of dwarfism. This is the most common form. Maybe you recognize some of these actors. We have Peter Dinklage. I know him best from the movie Elf, but also very popular in Game of Thrones. And then this guy is Jason Acuna, more commonly known as Wee Man. So yeah, there are more than 300 forms of dwarfism. This is by far the most common, and this is a delayed or abnormal growth of cartilage. And what this image here is showing is that these patients have a normal torso and head size, but their limbs are just shorter. Oral findings you may see is mandibular prognathism. All right, just a few more conditions to cover for this bone healing and pathology series. I'm going to talk a little bit about osteomyelitis, different forms of osteonecrosis, and then osteochondrosis. For my students, this is going to be a bit of a review, so I'll go fairly quickly. Osteomyelitis is just an infection of bone in the marrow space, typically caused by the bacteria Staphylococcus aureus. And we have two different forms of infection, acute versus chronic. Acute is when it's fast onset, kind of short-lived, hasn't been there very long, whereas chronic has been there for a while, long-standing, loss of blood supply, and that can lead to necrosis of the bone. So acute is more associated with pus, so pyogenic and abscesses can develop. And sequestrum, what's a sequestrum? That's when necrotic area of bone is walled off from the rest of the tissue. These are a few examples from the book. This first image shows the two classic signs of osteomyelitis, the periosteo reaction, which in osteomyelitis it tends to run parallel with the bone around it. Sometimes we refer to that as onion skin, especially if there are multiple layers. And then what is the black arrow pointing to? Well, we have this denser area of bone surrounded by radiolucency, and this is a sequestrum. The White and Farrow book talks about a sequestrum as being the hallmark of osteomyelitis. So if you see that, but especially if you see a sequestrum and a periosteo reaction, it should be a slam dunk that it's osteomyelitis. In this case, we see somewhat irregular, but it looks well-defined radiolucency. It's also surrounded by ill-defined sclerotic bone, so that's a classic sign that there's an infection going on. This one has a lot of inflammatory sclerotic bone around it, but right here it looks very radiolucent. And this is what the book talks about as being an acute osteomyelitis. I think of that more as a clinical diagnosis, although for acute osteomyelitis, when it's ill-defined and it can look a lot like malignancy, where it's just destructive and destroying bone, maybe it's eating through the lamina dura, that's more your acute osteomyelitis. And that's where radiographically I would say this has a lot more signs of acute osteomyelitis or acute infection going on. In this case, I pointed out the sclerotic bone, but there's also this sequestrum, so a dense area of bone surrounded by radiolucency, and so that's an osteomyelitis sequestrum as well. All right, so what is osteonecrosis? This is just dead bone. That's what necrotic tissue is. So radiographically, you're going to be very similar or identical to osteomyelitis, but there's some outstanding cause. As opposed to osteomyelitis, which is just infection, and in most cases that we're going to see, it's a tooth infection that causes it. Osteonecrosis is caused by one of two things, either radiation-induced or medication-related. And so what are we talking about with radiation-induced? This is not response to diagnostic imaging, whether dental imaging or medical imaging, but it is a response to therapeutic radiation. So they'll have a history of head or neck cancer, which was treated with radiation, because that's multiple orders of magnitude higher radiation than what they're exposed to for just your typical diagnostic procedures. And so that has an effect on all the tissues, all the cells in the tissues in the area. That can destroy some of the vasculature leading to it. That leads to necrosis. And that's what we call osteoradionecrosis. So the first stage of the change, when you're starting to see changes in bone and you may see kind of irregular patchy appearances, the PDL space may be widened, that we may just refer to as radiation-induced changes, and we don't call it osteoradionecrosis until there's definitive signs of necrosis of bone. And usually that's a clinical diagnosis. If you see long-standing exposed bone, that's what tells you that there's osteoradionecrosis going on. And similar is true for medication-related osteonecrosis. And so typically we talk about bisphosphonates, but there's more new agents that can cause medication-related necrosis. Anti-androgenic agents can do it. And so if a patient has been on one of these medications, but specifically if they've been on IV bisphosphonates, that's where the greatest risk is for osteonecrosis. And so what's the takeaway from this is if a patient does have a head and neck cancer and they're going to receive radiation treatment, you want to be more aggressive about treating teeth. Extract any hopeless or compromised teeth before they start to get the radiation. And then same is true if you know they're going to start to go on one of these medications, a bisphosphonate. It's best to probably extract the teeth and let the jaw heal before they undergo either of these therapies. All right, osteochondrosis. And I think this is kind of a strange topic to include in dental boards, but it always comes up in board review material. And so we're going to talk about it because this is something that occurs outside of the jaw, outside of our typical area of interest. It's also called avascular necrosis, just a loss of arterial supply to bone that leads to necrosis. It's an unknown etiology, but there are these specific sites where it's known to occur in the epiphysis or the growth center of bone.